Good morning, good afternoon, good evening. Great to have everyone here with us today. I'm Dr. Tom Hunsaker, Associate Dean of Innovation for the Thunderbird School of Global Management, and really excited to be able to share a few moments today with you talking about what really is a phenomenal program. And I think equally, or maybe even more so, thrilled to share it with some of my esteemed colleagues. A couple of words before we get started here. As you have questions, please leave those in the Q&A section. We're planning to leave a good 15 minutes at the close to be able to address any additional questions. We'll do our best to capture some of the more salient questions within the panel discussion here. Invariably, some additional things will come up, and as they do, please feel free to leave those in the questions. We'll try to answer as many of them as we can, and if there are any that we don't get to, we'll certainly reach back out to you with responses to those questions. This is an incredibly interesting, albeit challenging time in the world, but in particular in the healthcare sector. It's also an incredible time in the healthcare sector. So really thrilled to be able to share this time with you and share a bit more about how this degree program came to be and what really distinguishes it on a truly global scale. As I mentioned, I'm Professor Hunsaker. Really love working in this space. I kind of wear two hats at the Thunderbird School, Associate Dean of Innovation, and then also Professor of Global Strategy. With us today also is Dr. Rick Hall. He's Senior Director of Health Innovation at the Edson College of Nursing and Health Innovation at ASU, and has been instrumental in the design of this program and certainly a huge advocate, and will likely be a key player in this degree program going forward. And then the very seminal and my good friend, Dr. Gary Gibbons, clinical professor at the Thunderbird School of Global Management and a resident expert in a number of things, as well as one of the key founders and the head of the angel investing network that has a huge healthcare orientation, originally as part of Thunderbird and now part of the broader ASU ecosystem. So what we want to do is we recognize that many of you, if not all of you, are familiar with the Thunderbird School of Global Management and ASU. Just want to do a couple of slides as a bit of a recap or reinforcement of some of those more salient points. And then we'll spend the bulk of our time in a panel discussion here. I'm now completing my 10th year at the Thunderbird School. It goes by pretty quickly to be able to now say a decade. And what attracted me to Thunderbird originally is certainly very true today. Thunderbird was the vanguard of global business, back when global business wasn't really a chic thing. The turn of World War II, at the close, there was a lot of consideration of what the world would look like. And there was this founding mantra, this notion that borders frequented by trade seldom need soldiers. And there were very enterprising people who returned home from those atrocities and thought, we don't ever want to return to that. And they founded this kind of bastion of a school in the middle of the desert outside of Phoenix, Arizona. That school, over time, rose to be top in its field. Now, under our current leadership with Dean Sanjeev Kagram, it's really becoming the vanguard of the vanguard and reimagining all kinds of new horizons in global management, and then certainly the connectivity that comes with the fourth industrial revolution. So couldn't be more proud to be part of the institution. In addition to that, there's this incredible opportunity to be part of this broader ASU ecosystem. And with that broader ASU ecosystem comes this kind of dual benefit. On the one hand, you've got this Thunderbird alumni network, now pushing 50,000 strong, approaching 140 countries around the world, almost equally dispersed between North America representation and global representation. I dare say there may not be a richer, stronger global alumni network in the world. And then you really pair that with the might and power and scale of ASU, and this combination of Thunderbird and ASU and the innovative ability to just act on ideas and bring them forward has really been unparalleled, certainly in Thunderbird's history. I would also say in ASU's history. Now with us, we have Dr. Rick Hall. We'd love for him to share a few words about the Edson College and just what makes this combination of these two colleges coming together to mount this degree program such a unique and valuable offering.
Thank you, Tom. Very excited to be here and talking to you all today. The Edson College has been around since 1957. We have over 4,000 students at the graduate and undergraduate program, ranging from bachelor's degrees all the way to the PhD level. The term Edson comes from a philanthropic gift from Mr. Edson, who gave $25 million to the college. He has a very strong entrepreneurial background and really believed in the mission and the goals of our college, which is an innovative college. So if you look at the last part of that, the Nursing Health Innovation, I'm the Senior Director of the Health Innovation Programs. And we've been teaching health innovation and healthcare innovation for over 14 years, completely online. We were the first Master's Healthcare Innovation program in the country. So this really made a lot of sense to partner with Thunderbird and create this Master's in Global Management that has a focus not only on healthcare services, but innovation and entrepreneurship. So very happy to be here and very happy to be a part of this partnership.
Absolutely. Thank you, Rick. So then just to recap a little bit, some of the distinguishing characteristics, but then certainly we'll bring those to life through this panel discussion here. It's the world's only #1 rated degree program that is delivered in a blended format. We know that most of you, if not all of you, are busy professionals. And the idea here is to really borrow from the best of both worlds, bringing those to life through various practica as well as some really dynamic online instruction. So with that, let's get into the actual discussion and some of the key questions. And what we've done is brought together kind of common threads of the questions that we've heard from you all that have been shared with us through our wonderful partner, Dignity Health Global Education, and also some additional things that from a faculty perspective, we thought would be relevant to you, recognizing also that we're very happy to answer any additional questions that you might have. So with this, we're going to bring Gary and Rick into a bit of an interactive discussion here. And let's start off with you, Gary, and help us understand a bit more kind of the founding notion of this Master's in Global Management and Healthcare Services. What was the rationale behind it? And what is it that makes it so distinguished, so unique?
Well, I've been at Thunderbird 15 years, and over those 15 years, we carefully track industries around the world. One of the things we noticed was that as countries gained greater and greater shares of a global GDP, in other words, as the gross disposable product of the world grew, countries, whether they were emerging or developing countries, they began to, one of the first things they wanted is they got a larger share of the world's pie, so to speak, is the healthcare system or an improved healthcare system. Now, we became aware of that because as Thunderbird, that's the environment we do function in, that global environment. That's where our research is in, and that's where we travel the world and give symposiums, lectures, and do our research and around the world. So we noticed this phenomenon that countries growing, getting more disposable income, and as soon as they do, wanting more healthcare. So, and that being a global phenomenon. So as Thunderbird, we thought healthcare is global, and that global element of healthcare will become more and more important. And there aren't really any programs in healthcare management that are global in nature, whereas Thunderbird can provide that. The other thing we noticed is that as we looked at domestic companies, even say a small regional hospital in Nebraska, if you drill down into that small regional hospital, what you'll find is that somewhere in that hospital is close connections with the global community. And that's because the supply chain in healthcare, and this is especially apparent if you've been paying attention to the news lately, the supply chain in healthcare is global. So even if you're at a Nebraska hospital, if you happen to be working in the supply chain part of the hospital, you're ordering your PPEs from China, so, or from Vietnam, or from Malaysia, or Indonesia, or India. And probably a good portion of your staff is from these other countries. So those two motivators were key motivators behind this global program. First, the world wants more global healthcare, and it needs more global managers to deal with it. And second, even if you're not inclined to work overseas or work globally, even if you're working here in the US, you're working in a global environment, because your environment, your company is going to be somewhere connected to companies and peoples overseas. So that led us to believe we needed a global management program for healthcare, Tom.
Yeah, fantastic, Gary. And I, you know, as you were talking, I couldn't help but put my strategy hat on and just reinforce that we're always looking for upward trends in which to apply our resources, and no resource more important or more valuable than ourselves. And we certainly see an upward trend in healthcare, but certainly also a very shifting, a very dynamic trend within that, and no more dynamic than the trend towards global. So thank you for that. Awesome. Rick, talk to us a little bit about this notion of having pillars within the degree program. And we talk about various pillars of innovation. Love for you to build out a bit more for our wonderful participants here, what those pillars are and what they mean to them.
Certainly, thank you. We look at the process of innovation as multifactorial. So one thing affects other things, and we look at it from a systems approach. So we talk about the 7 pillars of innovation, and one is policy, healthcare policy. As we know, policy affects healthcare, whether it's the Affordable Care Act or some of the recent legislation that has been introduced as related to the coronavirus and COVID. Evidence-based practice, of course, is another one. We look at outcomes, we look at leadership, and the other pillars that we really focus on, and we've purposely put these courses into this NGM offerings, are finances, technology, and the innovative process. So we specialize in each of those areas, looking at them as a whole and looking at them from a systems approach. You can't innovate in one space without affecting the other spaces. So we want to make sure that we're discussing them all in the same time.
You know, and one additional thing there, Rick, and thank you for that really, really fantastic input. Both of us, both Edson and Thunderbird, teach innovation, and yet it was the combination of bringing together your incredible kind of technical, specialized healthcare lens and our global management and leadership lens, and then applying it through those 7 pillars that made just a pretty fantastic breakthrough in what we could offer the world of kind of education aspirants. So thank you there. Gary, talk to us about the modality here. Why blended, and what is it that makes blended such an interesting way to go through a higher education experience?
Well, everybody's busy, and we expect that the people in this program will be busy people. We don't expect them to be couch potatoes. So we believed that we needed to deliver a product that, an educational experience that people who are working in the field could avail themselves of. So we wanted to approach busy people. But there's a few aspects, there's a few things where you just can't do it online. And Thunderbird has always been a pioneer in the practicum approach to teaching. This is not an internship. Practicums are not internships. Practicums are not case studies. They're actual real-time experiences, real client, real time, real problem. And we take teams of students and we task them in that environment to work with real companies to solve their real problems in order to round out their education. So we can deliver a lot of the theory and a lot of the state-of-the-art knowledge via online, but we wanted this practical approach to supplement that learning. It is the only program that does exactly that. So we need both parts of that. The other thing I'll point out is that the practicums are really great line items on resumes. I've conducted probably 30, 40 of these practicums over my 15 years at Thunderbird. And invariably, students get important references in their resumes for practicums, from the practicum experience, from the client that they had during the practicum. So you're not just getting a line item or a recommendation from your existing employer, but you're going to end up with a new recommendation from essentially someone that's a new employer that you've done work for on your resume. And we value this experience greatly, and we find that the students value it greatly, and it helps them if they do go and look for a new job. It helps them immensely because they have a new current referencing a specific skill and deliverable that they created. So we need both parts. We need the book learning online for the busy professional, and we need the practicum for the person who needs to round out that experience with in-person learning.
Yeah. You know, for this next question, let's bring both of you into the mix. And Gary, let's start with you, but Rick, also love to have your thoughts here. Talk to us a little bit about a bit more about the special nature of this combination of Thunderbird and Edson, and what kind of attributes that might include. I know we've briefly touched on it, but let's try to drive a bit deeper and talk about some of those key attributes.
And you want me to start?
If you could, Gary, and then Rick, love for you to round out any thoughts that you would like to share.
Well, Thunderbird alumni tend to overrepresent themselves in the entrepreneurial areas. And one of the things we learned when dealing with Edson College is that, or the Edson School, is that they also are very entrepreneurial and innovative. Thunderbird's been a pioneer in teaching entrepreneurship and innovation in a global environment. When we went to visit with the folks over at Edson, we found out that they were innovators or they were pioneers in delivering innovation in healthcare specific items. So the combination between these two colleges is really very, very logical, and it's very strong. It's a very potent double whammy, if you will. Innovation in healthcare coupled with innovation in global management, it really imparts a significant, important learning experience to the students, and the students are able to build on that as in their careers, to make their careers progress. So we're thrilled with the connection between the two colleges, and it worked out very well.
Thank you for that, Gary. Rick, love to hear a few thoughts from you on this topic.
Sure, thank you. I would add that, you know, I agree with Dr. Gibbons. Our background is strong in innovation and entrepreneurship. Our background is not as strong globally. It's like Dr. Gibbons was mentioning earlier, healthcare is a global situation. No matter where you work or what you're doing in healthcare, it's a global situation. So the fact that they're also strong entrepreneurship innovation, and we could bring in the resources of what we have. For example, I run a health entrepreneur accelerator lab. Although it's physically located in Phoenix, Arizona, we support entrepreneurial activity globally. So if someone comes to us or one of our students come to us with an entrepreneurial idea, we help support that, try to find opportunities for funding for them, those types of things. We also run a MedTech accelerator with our local healthcare system where we recruit in healthcare startups from all over the country, and we try to accelerate them to the healthcare business or healthcare services. So I believe that the combination here, it makes us extremely powerful and extremely unique in that we can combine our efforts in entrepreneurship and innovation and global services and global education to make not just the most unique, but probably one of the most powerful healthcare leadership programs in the country that I've ever heard of or experienced.
Thank you for that. And you mentioned entrepreneurship there. I know that's near and dear to you, and would love for you to be able to share a bit more with our participants here about what you see to be the role of entrepreneurship and certainly add entrepreneurship in healthcare services, and how this program might help along that pathway.
Yeah, certainly. For me, and this is probably a question we should both answer also, because this is another area that we're both very strong in. Entrepreneurship is not necessarily, it could be you getting into business for yourself and starting your own product, services, or idea, but it also could be just applying entrepreneurial thinking to the healthcare organization that you belong to. And so we need that. We need leaders who are coming out of our programs as healthcare entrepreneurs or entrepreneurs in general. An entrepreneur is someone who's applying those principles within the organization they belong to. But if you can grasp and learn about the concept of entrepreneurship, those skills are translatable in any environment that you work in, whether it's a community health organization, whether it's a hospital organization, whether you start your own services. But to me, the essence of an entrepreneur is someone who sees a problem and creates, tests, and validates a solution to that problem, regardless of what the problem is, regardless of the environment that it's in. So entrepreneurial thinking and entrepreneurial skills can take our healthcare system and help them in this time of massive disruption. So we need those innovations and innovative courses as well, but the concept and the topic of entrepreneurship, it's different from an innovation, but they also work hand in hand. So, and Dr. Gibbons has written books on this topic. So the fact that we have this combination makes it also very powerful. So maybe Gary, you can also mention what you think about that.
Well, I'm such a believer in the concept that I'll be redundant if I talk too much about it. All I can say is that after seeing the program at Edson and knowing what Thunderbird has done around the world in terms of entrepreneurship and entrepreneurship, I couldn't think of a stronger connection. And that's why we purpose-built this degree program the way it is. That's why Edson is delivering the parts of it it's delivering, and why Thunderbird is delivering the parts it's delivering. As far as I know, there is no place in the world that you can get a #1 ranked master's degree in healthcare services, mostly online, and yet still get the parts of it, that would be the practicum parts of it, that are going to train you in face-to-face solving of real company, companies' real problems. So I'm the choir, I guess, but I believe in this program. And I also believe that that healthcare moves so quickly and so fast. I mean, face it, in the US, it's almost 20% of our GDP. And in the world, it's becoming more and more and more, a larger and larger percent of the world's GDP. So the opportunities in healthcare are there. And this is a program that's designed to train people to take advantage of those opportunities. It doesn't necessarily mean that you've got to go to the ends of the earth. It means that even if you stay here domestically, you're going to be faced with dealing with people from Indonesia, China, and Vietnam, and Germany, and Sweden. You're going to be faced with dealing with durable medical providers, service providers, software providers from all over the world if you work in this field. It's a wonderful field, it's very rewarding, and it's growing very rapidly. Just look at what's happened in the last 2 months. We had we had a healthcare system that is largely delivered in person. And in the last 2 months, 70% of all primary care physician services are being delivered via distance, via some kind of teledoc connection. You can't go to visit your physician now. So you need to be educated in how what's happening, what's coming, what's the next edge in the healthcare environment. And that's what we intend to do in this program.
Thank you for that, Gary, and yes, Dr. Hall and Dr. Gibbons. Really incredible responses. And in addition to the informative nature of the responses, it's just so helpful, and I guess such a luxury to be able to meet with and talk with the faculty who are not only putting it together, but will be largely involved throughout the experience. Gary, why don't we close out with you? And we've mentioned the practicum experience a number of times. Love for you to take our audience here through a little bit of the day in the life type of an experience that would unfold as they're doing the practicum. And then from there, we'll close out this part of the webinar and transition into Q&A with our participants.
Well, we have focused on the practicum as being one of the unique aspects to the program. And so the first thing you should know about the practicum is that you will work in a team. The team won't be overwhelmingly large, and you'll be assigned to a company. And the company will be at some stage of development within the healthcare business cycle. So it could be a startup company, or it could be a more mature company looking to expand overseas. But you will be assigned to that company because that company has some issues that it wants your help with. So your team will be responsible first for researching the company's, the subsector that the company is in, so that you know enough about the company's environment to help them. And then second, identifying and specifying what the exact nature of the problem or solution you're going to give them is. And then number three, doing the research, coming up with a solution. And number four, actually providing it to the company. So it's a multi-step, essentially consulting project that you will do with a specific existing healthcare. And the company could be big or small. The companies that are involved in this, we get them from all parts of the spectrum, large and small, and early stage to more mature stage. But it's meant to be an in-person experience. Now, it doesn't mean that, it also means that you can, a lot of our practicum students intensive contact with contacts via telephone or web chat, because sometimes the company personnel might not be in a single location all the time. But in general, it'll be an in-person experience where you go to a place you can interface face-to-face with the company.
And they serve as these milestones, these capstones along the way. Between Dr. Gibbons and I, we've been doing this for about a decade now, and it's invariably participants come back and they tend to say a couple of things. One, it was hard. It challenged us. It pushed the boundaries. Two, I'm so glad we had the learnings prior to that because we got to see them really come to life. And three, despite some of the challenges along the way, I would do it again in a heartbeat. And that really has come to be sort of the mantra. It's intended to be stretching. It's intended to be challenging. This is not just to kind of symbolic in nature. This is intended to be a real life living laboratory, but it's also intended to be incredibly bonding as you go through the team experience, as you connect with your clients, as you work your way through that consultative process, and then ultimately emerge having contributed this incredible value, both to your client's system, but also to yourself and to your own learning and knowledge set.
Yeah.
So thank you all for joining us here. We're going to advance just a little bit, and then we want to get into some of the questions that are coming through the system here. Do want to make sure that everybody knows, if you don't know Lindsay, she's incredible. We've talked a lot about Thunderbird and Edson and the beauty of that combination. We really would add to that the Dignity Health system and the Dignity Health Global Education team is absolutely foundational, integral to everything that we're doing here. And Lindsay is top-notch in every way. So please direct any program-related questions to her, but she also has a very direct link to the rest of us. And we will continue to surface those responses as they come up. And then just couldn't be more pleased and frankly proud to have worked with DHGE and Edson and certainly Thunderbird to innovate in this way and bring this kind of truly unique and seminal global offering to the education space. With that, let's get into some of our questions as we're listening through here. The first one is, I'm glad you mentioned that all of the potential students are busy people. What are the committed hours for the practical parts of this experience? Gary, do you want to take this one? And Rick certainly would love for you to chime in as well.
Well, I'll start. The practicum is scheduled for about 10 days in the summer of each of these, of the 2 years it takes to do this program. And the practicum is a very busy time. That's probably the single longest, most intense commitment that's required. So you will have to work with a team, and you will have to hold up your weight. So if you don't, that's a problem, because you can't let either the school down or when you're working on your consulting project. So it varies from project to project, but I found that the practical part of this training experience takes more time on a weekly basis than a class does, for example. And we have what we call practicum learning here at Thunderbird that take place in the finance arena, where it takes almost full time. Our practicums aren't scheduled to require that much time, but they do require a major commitment during those 10-day periods.
And part of the reason for that is, again, to mirror these living laboratory, these real life experiences. So we have to have some time constraints. We have to have some real client issues. We've got to have some give and take there. But ultimately, think of it as like a week-long sprint engagement. And thinking or talking specifically for Thunderbird, we do this in every one of our degree programs. In fact, from our undergraduates through to our executive degree programs, everybody participates in one of these to varying degrees and to varying lengths, but they've just become such a pivotal game changer in the lives of the participants that we absolutely wanted to bring it to life here. For the sake of time, and as additional questions are coming in, I want to make sure that we can kind of cover the spectrum here. This one, Rick, really has your name on it, where it says, when it comes to entrepreneurship, does this program provide mentorship in addition to the apparent practicum mechanism?
Yeah, I'll go back to what I mentioned earlier. Through our Health Entrepreneur Accelerator Lab, we offer, I'm currently mentoring about 15 different startups, and 3 of those startups are physician-led. So people who are really busy, but also trying to do something entrepreneurial. And I've seen that actually increase now that people are home and quarantined and have extra time on their hands. But the reality is we do it all year round. We do it virtually, and we absolutely will help you set up, if you need to, we help you set up a business model around it, help you look for funding opportunities. maybe help you establish mentors or a board of directors or whatever it takes. And so the fact that Thunderbird and ASU work together on this enables all students in this program, as well as any other program that belong of an ASU or Thunderbird program, to tap into the resources of entrepreneurship and innovation of ASU organizations. So, which is quite large. I mean, we're known for it. We have an extra campus to support it. And we have funding mechanisms, both internally and externally, that we can point people to and help them launch their ideas. So absolutely 100%, that's what we're here for. We have dedicated team and full-time people that are there just specifically to support entrepreneurship for students.
Fantastic. A few more, I guess, more tactical questions coming in. Gary, why don't you take this one? I don't have an accounting background. Will I be able to understand the finance and accounting course? Let's address that.
Well, yes, you will. And we make an effort to make sure that you do. And for people who are verbal and not numbers oriented, it's one of the courses that they have. Finance and accounting is one of the disciplines that they have the most problem with. But we don't have people generally ever drop out of these programs because of their inability to get through finance and accounting. They don't always like it. But if you're going to be trained as a manager, one of the key things managers have to know as they move up into middle and upper management is how to function in the world of finance and accounting. And healthcare is very, has a component to it that is very finance and account oriented, and that's the acquisition of new equipment or new facilities. So you have to be trained in solving some basic finance and accounting problems so that you can understand what a healthcare institution's motivation is when it replaces old MRI number A, machine A, with new MRI machine B. That's essentially a financial decision. And we do teach you how to make those decisions, and that's a key decision that you need to be prepared to make in the healthcare environment. So my response is you can do it. We are focused on making sure students can do it. You may not always like it.
Fair enough, and certainly an unvarnished response there. One thing that I would reinforce that you said that I think is really, really important is finance and accounting as they relate to decision making. What that does is it really brings it to life. It makes it far more practical than, say, a straight theoretical approach. And that's very much the design and the orientation to all of the courses within the program, but then certainly the finance and the accounting set of courses as well.
I would add, Tom, that this is one of the key sets of skills that employers want people to have in order to move them up into middle and upper management, is to be able to understand these kinds of decisions, these finance and accounting decisions.
You know, this next question comes to us and certainly is a common question. Could you share some success stories, some cases of students having done a practicum and it being really valuable to them in their overall professional progression? Or, Rick, with the accelerator that you operate, love to hear a couple of use cases or a couple of successes that we could share with our audience here.
I'll give two recent ones. Had one student who took her capstone idea, which is similar to what we'll be doing here with the practicum, and created her idea was to train people who are incarcerated for nonviolent crimes to become healthcare navigators in healthcare systems. So it reduces the chance that people will go back into prison, but it also is a job placement opportunity for people for hospital systems who need those folks. Through our mentorship and the entrepreneurship element, she's raised over $100,000 for her idea. won several contests and awards, including at the HIMSS conference. She got third place for funding there. And last week I had another couple nursing students who, one's a PhD nursing student who basically is launching an app, which is like a Uber for nurses. So you can call a concierge nurse to your home using an app. And again, part of her capstone idea for her practical experience at ASU, she got into our entrepreneurial program, and last week won $10,000 for that idea. So these are people, two different examples of people who won funding without even having a product. Now, I can't guarantee that's going to always happen, but if it's a really good idea, people will sometimes fund those ideas just to get them started. So those are just two examples that I can think of recently. Of course, this combination program is brand new. So I'm very excited to see the outcomes of the students who join this program and how we can support those together, because this is the first time we're taking these two colleges and putting them together. And I think the outcomes of this are going to be exponentially higher in time with the students who join this program.
Well, this is a brand new program, but we've been doing these practicums for students in the healthcare area and healthcare startups for a long time now. And I have several students who've gone on to work for either venture funds or for private equity companies after their experience in doing essentially one of these practicums. And those students, report great job satisfaction because they learned the basics. They were introduced to the healthcare industry. They worked for, as we say, they worked for a real client, real problem, real time. And they put that on their resume, and that was enough to lever them into a job. So we have several students that have successfully moved on, matriculated to jobs in the industry.
Thank you both for that. Why don't we close out with this question? There's various designations out there. There's MBA, there's MGM, which is the designation for this one. I'd love for you, Gary, to share a little bit about the rationale behind an MGM and what it is about this particular MGM that really kind of stands out in the marketplace.
I'd be glad to. My own master's degree is a master's of science. And so there's lots of different designations you can get at the master's level. People think that an MBA is a specialized degree in business, but an MBA was originally designed for people who were technicians like chemists or engineers to get a smattering of the 10 business disciplines so that they could move on into middle management. A specialized master's degree, like a master's of science and finance, which is what I had, or an MGM, which is what this degree is a degree that imparts unique characteristics, not just a survey of characteristics, but unique characteristics to the student earning the degree. So in this case, a master's of global management is imparting the extra skill. First of all, it is a business degree, but secondly, it's imparting the specialized skill of dealing in the global environment. And of course, as we talked about earlier in this meeting today, that's the skill you want to acquire. Because even if you're home in Nebraska, you're going to be dealing with somebody in China or South Korea or Germany on your supply chain, for example. So Master's in Global Management is a management degree focused on functioning in a worldwide economy.
And then with this, if we were to envision this almost as a T, you've got this incredible horizontal with the management and the leadership and the global component, and then this incredible stem with Edson in the technical and specialized healthcare space. And that combination, as Professor Hall said earlier, is just unique in the sense that each of these two groups have been quite successful, if not wildly successful in their own right. And this is the first time that we're able to really bring the key strengths from both sides to the table here to bear here.
Yes, you get,
go ahead, please.
Specialized training in global management, coupled with innovation, entrepreneurship, intrapreneurship, and healthcare services. So it's a very on-purpose designed degree.
Well, fantastic. Thank you both so much for your time, your graciousness in being here with us. Thank you to all of you who have joined us. It's been phenomenal to spend what was a very brisk 45 minutes with you. So excited to those of you who are already going to be part of this program. It's certainly very excited for those of you who will be joining us. See yourselves as a bit of pioneers in this space also. We know that we're in an upward trend, and we know that we're heading in the kind of the sweet spot of that trend, and couldn't be more thrilled to take that journey with you. So with that, again, we'll refer you to Lindsay Granger with DHGE. Please direct any questions, comments, additional thoughts that you might have to her. And again, a very special and warm thank you to our panelist guests, Professor Gary Gibbons and Professor Rick Hall. And thank you so much to every one of you. Very much look forward to working with you in the near future here. Take care, everyone.